Hello and good morning. Thank you for joining us to discuss the Women's Health Protection Act, a federal bill that would end a number of the medically unnecessary restrictions on abortion intended to push this care out of reach. My name is Preston Mitchum, and I'm the Director of Policy at URGE, Unite for Reproductive and Gender Equity. I am honored to serve as today's moderator of the live stream press conference. We have an esteemed lineup today of members of Congress and legal and grassroots advocacy organizations. After speaking, each speaker will turn it over to the next speaker. At the end of the call, we will have time for Q&A for members of the press. And without further ado, we will begin with remarks from one of the original co-sponsors, Senator Blumenthal.
Thank you so much, Preston, to you and to URGE and CRR for your leadership in this profoundly important constitutional rights issue, racial justice issue, healthcare issue, and one of the profound challenges of our time. We're introducing today the Women's Health Protection Act, and I am really proud to, first of all, thank my Senate co-sponsor, Senator Baldwin of Wisconsin, but also our House allies and partners, principally Representative Chu, who has been so stalwart and steadfast, and others similarly so, Representatives Escobar, Presley, and Frankel. We are introducing this bill with more co-sponsors than ever before. We're now at 45, and we are still adding co-sponsors. And I think that's because of the urgency of the crisis that we confront at this point. We face a point of potentially heightened, scary crisis next year or later this year when the United States Supreme Court decides Dobbs versus Jackson Women's Health Organization. And it could not only chip away, but potentially overrule Roe v. Wade, at the very least, do profound damage to it. This measure would secure a provider's right to provide abortion services and a woman's right to receive them against the false and deceptive measures like trap laws and restrictions on healthcare that have been the subject of 500 different state statutes over the last 10 years. The pace of those state restrictions on abortion rights has accelerated over the last couple of years. What we've seen is an unprecedented assault on a woman's right to decide whether to continue a pregnancy. This kind of attack on women's healthcare is the reason for the Women's Health Protection Act. It is needed more now than ever before, and that's the reason that we have more co-sponsors, and we are building support. And if nothing else, I really want to emphasize how important building support is, raising awareness, heightening consciousness about the crisis that we confront. And I think it is the reason that we have the kind of building support all over the country as a result of the great work by the coalition of groups, mainly the Center for Reproductive Rights and URGE, that have done so much to build the coalition that we have already. And I thank them for their wonderful work in courts. There are days when I miss my time as Attorney General of Connecticut when I could go to court. I have been involved in this issue for many, many years, since my days as a law clerk for Justice Blackmun on the Supreme Court the year after Roe v. Wade, when we thought this issue was done. We thought it was over, that it had been decided. And yet now we face unprecedented assault and attack by states on a woman's right to choose. So I am very, very proud that we are introducing this measure today. And I want to now call on my our House partner, our principal champion in the House of Representatives, Representative Chu.
Thank you, Senator Blumenthal. Thank you for your leadership and partnership on this important issue. I'd also like to thank the tireless women who co-lead this bill with us, Senator Baldwin and Representatives Frankel, Fudge, and Escobar, as well as the Center for Reproductive Rights and URGE for their hard work. Today, we reintroduce the Women's Health Protection Act, or WIPA. In the last Congress, this was the most supported pro-choice House bill in history with 217 co-sponsors. Today, I'm proud to announce that with this reintroduction, we already have 176 original co-sponsors. And we need this strong support because today, the fight to protect abortion rights for all Americans is more critical than ever. Just a few weeks ago, the Supreme Court announced it would hear a challenge to a Mississippi law banning abortion after 15 weeks in a direct challenge to the constitutional protections established by Roe versus Wade. This is part of a deliberate strategy by anti-abortion extremists to use state laws in the courts to slowly chip away at abortion access. And in order to build these challenges, anti-abortion lawmakers have pushed nearly 500 restrictive laws through state legislatures since 2011. These laws make abortion difficult and sometimes impossible to access, and the restrictions and bans are only becoming more extreme. In 2019 and 2020, lawmakers in 7 states have passed bans on abortion at 6 and 8 weeks of pregnancy before many people even know they're pregnant. And in Alabama, lawmakers tried to ban abortion completely. And unfortunately, this strategy is working, and the war on a woman's right to make choices about her body has made it all the way back to the Supreme Court. Well, we know we can't rely on Amy Coney Barrett and Brett Kavanaugh to protect our rights, and we know that our rights shouldn't depend on what state we live in at the time. That is why we need to pass WIPA now. These restrictive state laws that require 2 separate visits to the doctor's office or require waiting periods or that the doors in the clinic be retrofitted to hospital standards have the largest impact on low-income women, women of color, and LGBTQ people. It's a sad fact that in this country, if you are white, rich, and well-connected, abortion will always be available to you. But we need WIPA to ensure that no matter where you live, what your background is, or what your zip code, you have the same rights to make decisions about your own body as anyone else. That is what WIPA would do. It would enshrine the right of abortion access into law by establishing a right for patients to receive and providers to provide abortion care free of medically unnecessary restrictions like the one in Mississippi. If WIPA were to pass, abortion access would be protected everywhere, even if the Supreme Court were to go and overturn 50 years of precedent and overturn or undermine Roe versus Wade. And that's why it's so critical. Next, I'd like to introduce a champion for reproductive rights, Senator Tammy Baldwin.
Thank you so much, Congresswoman Chu. And I want to thank everybody who has come together for this Zoom call. And I appreciate the opportunity to join everyone. In the states across the country, as you've heard, Roe versus Wade continues to come under attack. As we all know, Roe versus Wade is the law of the land, and it has been now for generations. So simply put, when Roe versus Wade is under attack, millions of women are at risk of losing the freedom to make their own healthcare decisions, and women's health is threatened. We will not stand by and allow the clock to be turned back 50 years on women's reproductive health care in America. And that's why I am so proud to stand with Senator Blumenthal and our colleagues in the House to introduce the Women's Health Protection Act to ensure that every woman has the right to access safe abortion care throughout the United States without interference from politicians. Importantly, our legislation creates a safeguard against the medically unnecessary bans and restrictions that are being placed on constitutionally protected reproductive health care. While there are a lot of politicians across the country who want to stand between women and their doctors and who seem to think that they know better than women and their doctors, the fact is they don't know better. That is why we must pass our legislation to protect the provider-patient relationship, to protect healthcare professionals that provide care, and protect the freedom and right of women to access this care. With the introduction of the Women's Health Protection Act, we are sending a clear message. Every woman in America, regardless of where she lives, deserves the freedom to make her own personal decisions about her healthcare, her body, and her family. And with that, I want to turn the call over to Congresswoman Lois Frankel, another champion of the Women's Health Protection Act.
Thank you, Senator Baldwin, and I'm honored to be here with my colleagues from the House and the Senate, all who are champions for women's equality. One of the most important life decisions anyone is ever going to make is whether to become a parent. And women should be able to make decisions about pregnancy and abortion free from the fear of politicians who shame and try to control them. Because lawmakers have no place interfering in someone else's pregnancy decisions. And part of our job as members of Congress is to put people's health and safety and real needs first. And living a safe and healthy life is a basic right that includes being able to get an abortion and other reproductive health care. Because when people have access to a full range of healthcare services, including birth control, abortion, and maternity care, they are healthier and their families thrive. So we must trust people to make decisions about what's best for their lives and their bodies. And alarmingly, state legislators have passed hundreds of unnecessary abortion restrictions in the past 10 years, like unnecessary waiting periods or unnecessary clinic regulations, sometimes forcing someone to drive hundreds of miles because of medically unnecessary visits or clinic shutdowns, resulting in additional costs of hotels, food, time away from work, and childcare. And let me make it clear, these restrictions are designed to control and dehumanize and criminalize women and or their providers. They steal from women the ability to make the important life-changing decision of if and when to start a family. And it is a violation of their rights and their basic humanity. And the reality is that those harmed the most by restrictions are Black, Indigenous, and other people of color, and people working just to make ends meet. And we know from history what happens when access to safe abortion care is taken away. Years ago, when I was just 15, before Roe v. Wade protected a pregnant woman's liberty to choose to have an abortion without excessive government restriction, I saw something I will never forget. I found a friend nearly bleeding to death as a result of a botched abortion. She chose to put herself through that danger because she knew something that only she could possibly know, that she was not ready to become a mother. I wish she could have trusted someone she could gone to help her, that she could have gone to a reliable health provider, and that she could have had a safe and legal abortion. And now, almost 40 years after Roe v. Wade, women are again being forced into these impossible situations. The Women's Health Protection Act is going to take the power to make these deeply personal decisions out of the governor's mansions, out of the state legislature, and put it back where it belongs, in the hands of women and the people they trust. So let's commit to a future where communities thrive, a future where we have all the freedom to control our own bodies, safely care for our families, and live with dignity. We need the Women's Health Protection Act to get us there. And with that, I yield to Congresswoman Presley.
Thank you. Thank you to my sister in service, Congresswoman Frankel there. It's good to sit at this virtual table with all of you justice seekers. Grateful to my colleagues and all the advocates that are joining us today. As our nation continues to grapple with several overlapping crises, a public health and economic crises, and the crises of white supremacy and police brutality that has robbed us of Black and brown lives, we have the opportunity and the responsibility to speak out against and actively dismantle racist and discriminatory policies. That includes the oppressive policies that rob people of color, low-income people, immigrants, transgender, gender, and non-conforming people of comprehensive healthcare and the right to make decisions for their own bodies. And in this moment, where anti-choice legislatures have made it clear that they will stop at nothing to ban abortion care, it is simply no longer enough to say that you are pro-choice. We have to proactively legislate racial and reproductive justice and meaningfully advance policies that affirm that abortion care is healthcare and that healthcare is a fundamental human right that must be guaranteed to all. That's what brings us here today, to put forward precise, intentional policy that meets the moment, reflects our values, and protects the bodily autonomy of all people, regardless of income, gender identity, or race. We have a pro-choice majority in the House, and we need to act like it. The Women's Health Protection Act is bold and responsive legislation that would codify a person's right to choose, free from government interference. And with the Supreme Court set on carrying out the far right's quest to overturn Roe v. Wade, which has been the law of the land for nearly a century, this bill could not have come at a more critical time. So I'm grateful to my colleagues and our advocates for their partnership in crafting this legislation. And I look forward to continuing to organize. As LaTosha Brown reminds us, whenever there is a threat to our rights, that organized power is realized power. So may we continue to organize, continue to mobilize, and to legislate until this bill is passed and the ink dries on President Biden's signature. And with that, I will now yield to my colleague and sister in service, my classmate, Representative Veronica Escobar.
Thank you so much, Ayanna, my wonderful classmate and sister in service. I too am so privileged to be with all of you and to serve with colleagues who honor women and honor our choices. We are here today in support of a badly needed piece of legislation. I am coming to you from Texas 16th Congressional District in El Paso, a state that has just recently passed some of the most restrictive women's reproductive pieces of legislation in our history. In fact, in Texas, under the newest laws passed and pushed by Republicans in the state legislature, they are not just turning the clock back on women's rights, but their draconian policies would eliminate reproductive rights and access to abortion, even for women in cases of rape or incest, even for women who are victims of rape or incest. That's how expansive this legislation is. It also criminalizes physicians and any person who offers support or help to a woman who is trying to make a decision over her future, her family's future, and in fact, over her own body. We have to get to this point to pass this legislation in order to ensure that there is equal access to healthcare for everyone. Because let's make no mistake about this, legislation such as the type that has been passed in Texas doesn't mean that abortion will go away. All it means is that, as my colleague Lois Frankel mentioned, that women would put themselves in dangerous situations in order to access their fundamental reproductive rights. Also, we have to acknowledge that women of privilege and wealth will never have a problem accessing their right to their bodily autonomy and to an abortion. It is women of color, It is marginalized women. It is women who are economically disadvantaged, who will be locked out of being able to make a choice over their own body, over their own future, over their own family. This piece of legislation, which I'm very proud to support and be an original co-sponsor of, and again, my deepest gratitude to my colleagues on both in the Senate and in the House who are supporting this. We have an absolute urgency today. We must pass this because the threat has never been greater in our generation. With that, it is my privilege to be able to turn this over to Nancy Northup. She's the president and CEO of the Center for Reproductive Rights. I'm so grateful for her leadership and her advocacy. Ms. Northup, the floor is yours.
Thank you. And good morning, everyone. I speak to you today from my vantage point of being the president and CEO of the Center for Reproductive Rights. And our mission is to ensure that reproductive rights are guaranteed in law as fundamental human rights by governments around the world. We have litigated hundreds of abortion rights cases since our founding almost 30 years ago, and have been involved in every Supreme Court case, including winning the most recent two, Whole Women's Health versus Hellerstedt in 2016, which kept the clinics open in Texas, and less than a year ago, June Medical Services versus Russo, which kept clinics open in Louisiana. Yet, despite these two recent Supreme Court victories for abortion rights, we are back at the Supreme Court again, defending the right to abortion. This time, in a case from Mississippi that is a straight-up test case to reverse Roe versus Wade. We will litigate this case vigorously, as we will the dozens of other cases on our docket, but the state legislative attacks on abortion are coming and getting more extreme, as you've just heard. I have led the center for over 18 years, and I have never been as alarmed as I am today about the crumbling state of legal protection for abortion access. As the Center for Reproductive Rights has documented in our report, What If Roe Fell, which is available on our website, if Roe is reversed, if Roe is significantly damaged, abortion will likely be banned in half the country. This is just simply unacceptable. It is time for Congress to act. The Women's Health Protection Act would ensure that throughout the country, every person has the right to access abortion care free of harmful bans and free of medically unnecessary restrictions that close clinics and impede access to services. The act would end the whack-a-mole going on across the country right now. States pass restrictions. We go to court. Courts block the laws, or sometimes not. And states pass new restrictions. And the whack-a-mole goes on and on and on. Meanwhile, as these court battles go on, access to care gets harder and harder to receive. State restrictions push abortion care out of reach and cause disproportionate harm for people already experiencing discriminatory, systematic barriers to care. The public is with us on this. Today, the Center for Reproductive Rights is releasing a poll from Hart Research Associates that shows that nearly 7 in 10 registered voters believe that the constitutional right to abortion should be protected. A strong majority support passage of this bill. And we're going to post the information about that poll in the chat. I applaud and thank members of Congress for advancing this necessary legislation in this critical moment. And now I will turn the conference over to Danielle Heard-Wilson, Interim Deputy Director and Field and Programs for URGE, Unite for Reproductive and Gender Equity. Thank you.
Hello, and good morning or good afternoon. Thank you to Senator Blumenthal, Representative Chu, and the other members for inviting us to speak today. And thank you to our advocacy partner, Center for Reproductive Rights, for organizing our efforts on this bill. My name is Danielle Heard-Wilson, and I am the Interim Deputy Director of Field and Programs at URGE, Unite for Reproductive and Gender Equity. URGE is a state-driven national organization building a young people's movement for reproductive justice by centering the leadership of young people of color and queer, trans, and non-binary folks. We defend abortion, transform culture, and build power where the challenges and opportunities are the greatest, particularly in the South and in the Midwest. URGE envisions a liberated world where we can live with justice, love freely, express our gender and sexuality, and define and create families of our choosing. And as long as abortion is stigmatized, restricted, and banned, we're prevented from making that vision a reality. Young people and Black, Indigenous, and people of color should be able to get abortion care free from unnecessary restrictions such as mandatory ultrasounds, waiting periods, and others that shame, stigmatize, and deny us timely, confidential abortion care. Healthcare providers who offer essential reproductive health procedures should be able to follow best practices. They shouldn't be subjected to regulations and laws intended to make it impossible for them to stay open. That's why the Women's Health Protection Act is so important. In particular, this legislation would create a statutory right for providers and their patients to deliver and receive abortion care free from restrictions. Abortion access is a racial and economic justice issue. We're appreciative that the Women's Health Protection Act bill findings go further than they have before in recognizing that reproductive justice is a human right that requires every individual to be able to make their own decisions about having children, regardless of their circumstances and without interference and discrimination. The violent legacy of restrictions on reproductive health care perpetuates white supremacy and anti-Black racism. It impedes bodily autonomy, and it compounds harm for members of communities that have historically experienced barriers to healthcare. Each of us should be able to make our own decisions about whether and when to become a parent, period. It's time to listen to the people most affected by reproductive oppression about what we need for our communities to thrive. The Women's Health Protection Act would be an important step towards that reality. Thank you, and now I'll turn it back over to Preston.
Thank you, Danielle, and thank you to our champions and incredible advocates. We'll now move on to Q&A. First, to flag the poll by Heart Research in the chat that Nancy mentioned, please do review it and check it out. And also, as a reminder to the press, if you have any questions, please directly send me a chat letting me know you have a question and I will call on you. When you ask your question, please be sure to introduce yourself with your first and last name and media outlet. Again, as a reminder, we are taking questions. If you have any questions, please feel free to directly message me. When you ask your question, introduce yourself with your first and last name and media outlet. I also recognize how exciting everyone else is, so we understand. All right, thank you so much, Carrie. You can ask your question.
Hi, I'm Carrie Baker from Ms. Magazine. I'm wondering if the Women's Health Protection Act would prohibit states from restricting insurance coverage of abortion.
Carrie, to clarify, was that question to anyone in particular or open to everyone?
I guess Nancy Northup or one of the, or any of the legislators.
Well, I'll just jump in quickly to say that there are a couple of limitations in this bill that it does not address. And one of those limitations is it does not address insurance or medical assistance coverage of abortion services. Very important bills are pending. I'm having a moment that are addressing those issues. So this is a companion bill to those that address the issues around insurance covering each act, which has been introduced recently and reintroduced from the last Congress. So this bill doesn't address that. The each act does. They're both companion bills to address access to critical issues on abortion care.
Senator Blumenthal, were you responding to the question? I believe you're muted.
Sorry about that. The bill we're introducing today, the Women's Health Protection Act, doesn't address the insurance issue directly, but Nancy's absolutely right. There are other bills that we will be advocating and championing that do. I want to add 2 points. We will be having a hearing next week in the subcommittee that I chair, the subcommittee of the Judiciary Committee on the Constitution. I believe it's next Wednesday, that will address a lot of the points that we've raised here and others that folks may raise. And I'm hopeful that we will clarify some of the questions that might be asked on this call. But this subcommittee hearing will be next Wednesday, the subcommittee on the Constitution of the Judiciary Committee.
Thank you, Senator. I will now pass it to Melanie Conklin. Good afternoon. Melanie, are you able to unmute yourself? All right. While Melanie is working on audio, I'm going to turn it back over to you, Carrie, with a follow-up question.
Hi, this is Carrie from Ms. Magazine. I was wondering, are there any Republican co-sponsors out of the 45 in the Senate or the 176 in the House? Or do you think you might get some?
None yet, but we're very hopeful. The Center for Reproductive Rights and URGE and other advocacy groups have done a magnificent job in building a powerful coalition. As I mentioned earlier, we have more Senate co-sponsors than ever before, and we're adding, indeed, as we speak. So I'm hopeful. I think the urgency of this issue is unprecedented. We face a really scary time, and the American public is responding without regard to partisan affiliation. You know, I want to give a shout out to the young woman in Texas, the high school valedictorian, Paxton Smith, who threw away her prepared speech and just talked about women's reproductive rights. That's the kind of spontaneous and also hard work that is producing the kind of support for this measure that is unprecedented, just as the urgency of the crisis is unprecedented. And as we near the Supreme Court argument, as we near the decision, I would expect that we'll have bipartisan support, at least I hope.
And let me just say, in the House, no, we don't have any Republican co-sponsors yet, but we certainly welcome their support. We know that there are Republicans that are in the House that are pro-choice. But let me emphasize again that in the last Congress, we had 217 co-sponsors, which was a historic high for a pro-choice bill. And already today we have 176 original co-sponsors on this bill. So I think that with the Mississippi case going through the Supreme Court, there'll be so much sentiment on this bill that we hope that it will propel Republicans to do the right thing.
And I just want to add one point, and I know we've had a lot of discussion on the different restrictions, but Nancy Northup made a really critical point. You know, Dobbs is a direct assault. It couldn't be a more direct assault on Roe versus Wade. A ban after 15 weeks. This court has chosen this frontal attack on constitutionally guaranteed reproductive rights. It's taking this issue head on. And I sat through and questioned the nominees to the court, the most recent 3, on exactly this point. And of course, they assured us they will respect precedent, stare decisis, all of the stuff they said, and now they are taking this case. So I think the American public gets it. And that's the reason why I think the support for this measure will be certainly larger than ever before. And Representative Chu is doing a great job in the House, along with Representatives Frankel and Escobar and Presley, of mobilizing support there. So I'm very hopeful about bipartisan support.
Okay, let's do another round of questions. If there are any additional questions, please feel free to direct message me. And if you do have a question, introduce yourself with first and last name and your media outlet. One more round before closing. Okay, all right, Melanie.
Thank you for bearing with me through the audio problems. I'm Melanie Conklin from the Wisconsin Examiner, and being from Wisconsin, of course, I'm interested in Senator Baldwin's answers, but from anyone else as well. I'm wondering if you can discuss, paths to this act actually becoming law and how that could happen, and then how might it interact with some of these legislative, this whole array of legislative restrictions on abortion. Thank you.
Hi, Melanie. Good to hear your voice. Let me first say that, as has been noted by many of the speakers, all of the speakers, that we've seen such attacks on Roe versus Wade at the state level through regulation and laws that have nothing to do with protecting women's health or safety. And so this law is intended to basically instruct the court, if you will, that unless it is something that furthers a woman's health or safety, it should be viewed as an invalid encroachment on women's constitutional right to reproductive freedom and abortion care. So that's how it would be utilized. I'm going to certainly have the lead sponsor in the Senate, my partner on this bill, Dick Blumenthal, talk about the path forward. What I would say is this, I'm a strong advocate for the Women's Health Protection Act. And right now we have a set of rules that we are operating under. And at this point, our goal is to get sufficient support to pass it. We also know this issue is coming up in reference to a number of measures, and we are continuing to figure out how we can press forward and achieve results in this environment. Senator Blumenthal.
Yeah, thanks so much, Senator Baldwin. Tammy is absolutely right in her explanation. I want to emphasize just a couple of other points. In the criteria that the court would consider in determining whether a particular state law interferes with the provider's right or the patient's right, the recipient of healthcare's right, they could determine not only the degree of interference, but also the delay that might result, because obviously time is an important factor. And in terms of enforcement, that question really, I think, focuses on enforcement as well. The Attorney General could enforce it. There's a private right of action, and there is an opportunity to get injunctive relief so that it would stop implementation of this kind of restriction in a way that is very important.
All right, thank you. Turning it over to you next, Susan.
Okay, I've unmuted successfully. I'm Susan Rinkunis. I'm a freelance reporter, and I'm curious how WIPA, if passed, would interact with any state constitutional amendments that do not, that say that there's no right to abortion in the state. Could those states challenge based on that?
I will give a somewhat simplistic answer to that question. Interesting, a good question. Federal law trumps state law. That's the simple textbook law school answer, which, you know, seems overly simplistic, but it is a fact. A state statute would trump a state law, a state constitutional amendment. That's the principle of federal-state relations in our Constitution.
Thank you, Senator. All right, one more round of questions. If there are any additional questions, please feel free to message me to introduce yourself with your first and last name and your media outlet. All right, there doesn't seem to be any more coming through. So I'm happy to take this time to conclude. So to our speakers, the press, and those watching via live stream, thank you. Abortion access is a racial and economic justice issue, and we must not forget that. And we know it is out of reach for far too many people who need abortion care. The Women's Health Protection Act gets us just one step closer to the reality of abortion access for all. And we thank you for your support and hope you have a great day.
Thanks, everyone.